everyone, I'm Jan Marini, the founder of Jan Marini Skin Research. I'm here with Monica, and Monica is a recruiter for engineers. She's here for a consultation. I'm going to ask her a few questions. So Monica, if there was anything that you could change or improve about your skin, what would it be?
I think I just want to be preventative as far as, wrinkles and everything, aging. I do have a little bit of dryness right now, which is not normal, but I think with the summer and everything coming, I get some dry spots, but other than that.
Okay.
Yeah.
Anything else besides the preventing wrinkles, dryness, anything else?
I think, like the under eye dryness as well. That's something that I also deal with. But
any breakouts or acne?
No, I'm actually pretty clear these days, knock on wood.
Okay. Anything that you want to change or improve about body skin, anything like that?
No, it's mainly just base, yeah.
Okay. And if you had to categorize your skin type, do you think it's more normal, oily combination? How would you categorize it?
I would say it's usually normal, except for the summertime. It does get dry in certain areas.
Now that's interesting because most people say their skin gets oilier in the summertime.
Oh, really?
But yours tends to get drier.
Yeah. Yeah, and I have pretty sensitive skin as well. So the sun and I do not cooperate.
So when you say sensitive skin, how do you categorize it? What happens that makes you think your skin is sensitive?
It doesn't necessarily happen on my face as much as like I'll get like a chest rash when I'm in the sun for too long. If I go on like a week-long vacation, I'll get that type of it looks like I'm breaking out in like hives or something.
It's probably a good thing because that means that you're not going to take up sunbathing.
There you go.
But does that happen even if you wear sunscreen?
Yeah. Okay. So I just it's too much sun exposure, too much heat.
Okay.
That's pretty much it. I have this I got this weird burn here. I don't know what it is, to be honest. I was in extreme heat in Vegas, and I had this dryness that isn't going away. So
interesting.
It's
okay.
Good timing.
A dry spot on your nose from kind of like a burn in Vegas.
Yeah. I was wearing sunglasses, so I don't know how it happened.
Well, chances are that could be something where the sunglasses just kept rubbing on that area.
Yeah.
And caused somewhat of an abrasion. Abrasion is what I meant to say. Have you ever been a smoker?
No.
Ever been a sunbather?
When I was younger and it was cool.
Okay.
Now
as a
I'm more
teenager?
cautious, yeah.
Did you ever have acne as a teenager?
Not an extreme case. Nothing that I had to get on anything for. So I was pretty lucky. I had certain areas at times, but not really.
Occasional breakouts?
Yeah, just occasional.
And were they breakouts where you would more get a papule, like a red bump, and it would turn into a pustule, or did you get nodules or cysts?
No, it would just be the first one.
Okay.
Yeah.
And so you didn't have to take anything specific for that?
No.
Okay. So tell me what you wash with in the morning.
Oh no, what is it called? Sorry. So I was using Roden & Fields for a while, and I don't remember the name of the type of cleanser.
Was it a cleanser? Was it a gel? Was it a lotion or a cream?
It was more, it had I think it was more of it was a little bit of an exfoliation.
Okay, and was it in a cream consistency?
Yeah.
So Rodan & Fields.
And then but I'm recently doing a different kind. My gosh, what's the name? I know they sell it at Nordstrom. It's that rose water type.
Micellar water?
No. But I've been using Roden was that what it is? Roden & Fields.
So recently. What you're using currently that you say you get from Nordstrom, is it more of a gel? Is it more of a cream, a lotion?
It's more of a gel, like a cleanser.
Okay.
Yeah.
And is that product, does it say on there that it's for a particular skin type, like it's all skin types or normal or dry? Does it have any particular?
I think it was all skin types.
Okay. And when you get done cleansing with that product, does your skin feel tight or dry, or does it feel pretty normal?
It feels pretty normal, yeah.
Okay. And what do you do after the cleanser?
I have like a facial moisturizer and an eye cream. It's the same brand that I can't tell you because I can't remember.
And the facial moisturizer, is it a lotion or is it a cream?
It's a cream. And then after that I put a
And is that
sunscreen.
more of a dry skin product? Or is it, again, any skin type?
It's any skin type, yeah.
Is there anything in that product that they kind of identify, like it has a glycolic acid or it has a peptide or anything like that? Okay.
Sorry.
And then you said after that you do...
I put sunscreen on.
Okay, and do you remember the brand of sunscreen?
No.
What SPF?
It's 50. Okay. And so when you get done during the day, does your skin feel pretty comfortable? You mentioned that currently you have some dry patches, and the one on your nose, is there any place else where you're feeling dry? I had a little bit here, but I think it might be going away.
Okay.
So other than that, no.
Okay.
Yeah.
And at night, same cleanser?
Same cleanser, and then I'm using that same face cream and eye cream as well.
Okay, so there's an eye cream as well. And of course, no sunscreen at night.
Right.
So how would you compare what you're using now to when you were using the Rodenafils?
Well, I get kind of impatient when it comes to skin products. So this was just kind of I'm trying to change it up to figure out this dryness. The difference. I think this one might be a little bit more moisturizing than the Rodenafils. Yeah.
And when you say that sometimes you get drier in the summertime, where do you tend to dry out?
It's usually like under my eyes. That's
Okay.
pretty much it, yeah.
Okay. So let's talk a little bit about what you're referring to. And I know when I talked to you on the phone, one of the things that you had said, and also that you said when I was asking you these questions about if there's something you could change or improve, is that you want to prevent wrinkles. And you want to prevent aging, which is really, really good, because most of the sessions that you've seen, the consultations that I've done, have been people that are experiencing visibly a lot of damage, sun exposures, certain aspects of the aging process. And so it's better if you can prevent it. Right. Okay, so let's talk a little bit about that. Okay. Most of the damage that you're going to see in your lifetime was programmed into your skin before the age of 10.
Oh.
And at least 50% of it is programmed into your DNA by the age of 20. So it takes 10, 20, 30 years to show up. So a lot of times, we might notice little slight aging changes, but a lot of people feel like their skin really doesn't age that much, maybe between 20 and 30. Maybe when they're 35 or 40, then I hear them say, wow, it's like I woke up one morning and all of a sudden I started seeing brown spots or lines around my eyes, or it was like somebody let the air out of my face. And once that happens, it's just kind of downhill. It's very rapid because that damage is starting to show up. Now you can exacerbate it. And you don't have to be a sunbather to have all of that damage programmed into your skin. It's just incidental sun exposure. Now, if you were a sunbather, it could be a lot worse.
Right.
And I've seen people in their 20s where their skin looks much older because sunbathing can really exacerbate that. So it's a good thing that you haven't had a lot of sun exposure. And so when we talk about sun exposure and we talk about some of the aging changes that occur because of that, there's actually two different categories. So one is what we call intrinsic aging. Now, intrinsic aging has to do with, there's three categories. One is heredity. And so you inherit your bone structure. Look at mom, dad, grandma, grandpa. That's gonna kind of give you an idea of how you're gonna age. And if you're like Sophia Loren, who's in her 80s, and you have these really high cheekbones, big eye sockets, and a strong jawline, and a long neck, and all that great bone structure, you're going to age differently than somebody else that doesn't have the same bone structure. And then there's, so that's heredity. Then there's intrinsic aging. So intrinsic aging, or true aging as we refer to it, is really all the things that happen to you as you age. For example, your upper lip by the age of 80, or excuse me, by the age of 60. I got that one wrong. By the age of 60, roughly 80% of all females will lose the show of upper teeth.
Okay.
So when you look at a fashion magazine and you look at models and they're not really smiling broadly, but they have a nice defined vermilion border, which you do, a nice upturned lip. But if you look at mom or grandma, and a lot of times if they're not smiling broadly, you see more of the lower teeth.
Yeah.
And so the lip actually elongates as you age. It flattens and it turns under. And then the platysma muscle, this is the big muscle in the neck, it pulls the corners of the mouth down.
Okay.
And then the other aspect of the aging process is that everything elongates, even earlobes, about a third of a centimeter in men and a little bit less in women. People sometimes will say, oh, but your nose keeps growing. And that's not really true. But if you have a prominent nose, it can look like it's grown because the tip can droop and it can broaden through the base.
Oh, I see. Okay.
And then there's something that people are challenged with, but in women, it's particularly challenging because the most feminine aspect of the female face is the cheekbones, high cheekbones. So you have nice apples of the cheek and your cheekbones are nice and high. But what happens is as you age, the cheek pads move down. And as they move down, you get what's called a nasolabial fold or a smile line. And then you also start to see sort of the sagging or the jowling in this area. And as the cheek pad moves down and this area flattens, the female face becomes more masculinized in facial appearance. Same thing happens in men, but in men, they become more masculinized, you know, that's probably a good thing. But when you look at people who have lived together for years, sometimes they say, oh, they kind of look alike. And it's because the female face takes on more masculine characteristics.
Okay.
And so those are things that really are where surgery comes in to play, because you can move cheek pads back up and you can work with redundant fat, and you get herniated fat underneath the eyes, and you get herniated fat down here, and anyway, it goes on. And I don't want to depress everybody. I don't want to depress you. But actually there's good news. Now, believe it or not, that's only about 4% of the aging process. So when you look in the mirror, and the things that people really obsess over, they start to see, okay, my pores are looking larger. I'm starting to see fine lines. I'm starting to see textural changes. My skin's not as bright. Oh, I have little brown spots. I'm getting lines around my lips. All of those things, 90 to 95% of what we perceive as inevitable aging is sun exposure.
Okay.
So that's the part that can be prevented. And even with the sun exposure that maybe is evident, there's a lot you can do to decrease the appearance of that, a lot. And you can spend huge amounts of money on products that really don't do much of anything. I'm not saying that there aren't some good products out there, but the average woman has $600 in product in her bathroom she doesn't use. And so when you can find things that really have medical validation that can make a difference in this area, you truly can, truly decrease the appearance and also a lot of prevention. Okay, so that's kind of what we're going to do today. Now, in terms of under eye dryness, the under eye area doesn't have oil glands, so that's an area that does tend to be a lot more dry. But also, sometimes individuals perceive more dryness in the under eye area because they're using a product that possibly could be causing a little bit of contact dermatitis. And with contact dermatitis, what's happening is it's kind of like it's attacking your skin because there's something about it that your skin doesn't like, and it fights back. And in doing that, oftentimes the surface of the skin can be very, very dry. It's sort of an immune reaction. And it's not quite like an allergic reaction in a way, an out-and-out allergic reaction where you're like going, oh my God, I'm itching, and I'm seeing like hives and things like that. And I don't know whether that's the case or not, but what we can do is we can provide more lubrication under the eye area, and we can see if that makes a difference. What we want to do is, in order to kind of sort of put you in this preventative mode. Okay, so number one of the best things that you can possibly do is something called resurfacing. And resurfacing is a term that I use that really addresses superficial skin imperfections. So when people say, oh, gee, my skin is dry, or I see fine lines, or I see my pores are larger, or it's not as bright, or I wish my skin just had more of a glow, on and on and on. Resurfacing is a way of using a combination of acids can address all of those different concerns, the appearance of them, as well as mild to moderate acne, appearance of rosacea, those kinds of things. So it makes the skin look more perfected.
Yeah.
I always use the analogy, if you've ever watched an award show and you see the celebrities walking down the red carpet and they look like, and they're wearing makeup, but they never look like they're wearing, a lot of face makeup, but their skin just glows.
Yeah.
And you want that look.
Yeah.
Without having to wear, a lot of foundation. So that's kind of what resurfacing helps to do.
Okay.
And then we also want to use topical agents that can address the appearance of some of the damage that you may already have sustained, as well as help to prevent the appearance of some damage that hasn't shown up yet. So those are kind of the areas that we want to focus on. Okay, so here's what I'm going to recommend for you. I am going to recommend the skincare management system for our normal combo skin.
Okay.
Now, even though I think your skin is normal, and I believe that it tends to maybe get a little bit drier, generally when we talk about dry skin, it would be like you would be saying, wow, I'm really tight and dry in my cheek area. I really feel like my entire face. So those areas where you're getting dry could be just areas of sensitivity or irritation.
Okay.
But actually, the normal combo system is going to be more emollient than what you're used to using. And this is going to be a glycolic cleanser.
Okay.
It's and one of the reasons why I almost always recommend a glycolic cleanser. First of all, the base of this is very gentle. Have you ever heard of a cleanser called Cetaphil? Okay, Cetaphil is always recommended for people that have really sensitive skin, or maybe they're going through a contact dermatitis or allergic reaction, because it is just so incredibly gentle. Well, this is a base very much like Cetaphil, but it has glycolic acid in it. And glycolic acid can actually get into the follicle. So you can have the best cleanser. I make non-glycolic acid cleansers, but the molecule is too large to get into the follicle. So in terms of being able to really help to address follicular retention, the overall smoothness of the skin, the refinement of it, it's superb.
Okay.
The second thing is a lipid-soluble vitamin C. And there's a lot of different aspects of this product that can help with the prevention and that type of the issues that you talked about. Next is what I call the big guns, which is something called BioClear, and it's glycolic, salicylic, and azelaic acid. That is a superb resurfacing agent. For example, azelaic acid is actually sold by prescription for acne. It's sold by prescription for rosacea. It's one of the best resurfacing agents we have ever seen for fine lines. It brightens the skin, and when you put it together with glycolic and salicylic, I've never seen a better resurfacing combination. It is really superb. There's a hydrator in here, which is called Transformation, and there's also a sunscreen.
Okay.
Now, the sunscreen is one of our cult favorites because it has the highest rating that you can give a sunscreen for UVA and UVB protection, which is really critical. But it also has an oil capture system. Now, that's not something that you're concerned about. But let's just say that you were a person whose skin tended to be the largest category, which is combination. It has an unlimited capacity for oil absorption. It cannot absorb water, can't absorb actives. Any place where you're dry, it's going to make you soft, silky, and just feel really, really hydrated.
Okay.
So that's going to be your basic system.
Awesome.
Now, the other thing that I'm going to do, which I think is really critical, is I'm going to put you on a product called Retinol Plus. Now, you're not going to start using this right away, but Retinol Plus, there is more medical data in terms of aging, in terms of all of the issues that go along with the aging process on retinoids and glycolic acid than virtually any other topical agent out there.
Oh, wow.
And so in terms of prevention, in terms of being able to address anything that may be already starting to show up, whether it's fine lines under the eyes, whether it's dryness, all of that, this is going to be something that's going to really serve you well for the rest of your life.
Okay.
And we're going to keep the program simple at this point. I'm also going to recommend our Luminate Eye Gel. And there may be A couple of other things that we're going to add in your program or kind of switch your program around. One of the things that I always like to say is that you may say to me a month or 2 months from now, Jan, my skin is the best it's ever been. I can always actually take it to a higher level of skin rejuvenation.
Okay.
So we're going to continue to work with you.
Awesome.
We'll check back with you in about 4 days.
Okay.
And not only do we check back to make sure that the products are being used correctly, but sometimes, and it's rare, there needs to be a modification. It could be having to do with the time of year. It could be having to do with lifestyle or who knows. But at any rate, we want to make certain that the products are doing what they should be doing.
Okay.
And then what we do is that we continue to work with you because programs need to be modified.
Yep.
I mean, maybe her skin is not going to be as dry going forward. Maybe it's going to change. Her skin could be very different in the winter than it is in the summertime. What if she goes into perimenopause at some point and starts to develop acne? Something to look forward to. But there's just different things that can occur. So we want to make certain that your skin continues to look really bright and healthy and glowing. And by the way, 100% of all individuals by the age of 35 will have abnormal pigment. So it's not unusual that when somebody gets into their 30s, that they start to see, oh, I've got some discoloration on my face. And so we would like to prevent that, but also there are things that we can do to address that as well.
Awesome.
So we'll continue to work with you.
Okay.
Do you have any questions for me?
No, I think you covered all my concerns. The only question I do have is when you're, I guess, wearing makeup, you apply the sunscreen on first. Is there any other way to like reapply it without having your makeup fall off?
You know, that is a great question. If you're going to be outside for prolonged exposure, you really do need to reapply your sunscreen. And there's no way around it. Either you go without foundation and maybe you wear a tinted sunscreen, but a tinted sunscreen, you can't put it on like foundation. You've got to really put it on well over your ears and your chest and everything. Or you just have to say, you know, I'm just going to screw up my foundation.
Okay.
Yeah, I know that's a tough one.
Yeah.
It is. And some people will say, well, I just reapply mineral powder. Keep in mind that with the new laws that have changed, sunscreen is considered an over-the-counter drug, and there are different laws now for sunscreen. And so most of the powder foundations, the mineral powders that used to get an SPF rating, most of them are no longer allowed to make those claims. And plus, who takes mineral powder, or any powder for that matter, and goes, okay, I'm going to put a really thick coat all over my whole face, on my ears, over my lips, on my neck, and on my chest. So, yeah.
Okay.
Anyway.
Just reapply it.
Yeah,
safer.
Just have to reapply it.
Okay.
Any other questions?
No, that's pretty much it.
Well, with that said, I think I'll say goodbye. Thank you so much for watching, and please don't forget to subscribe. Bye.